Hi, my name is Lindsay McGee and I am the waiver manager at the Bureau of Developmental Services, BDS. These recorded training sessions are intended to provide information on each service available on the Developmental Disabilities, DD waiver, Acquired Brain Disorder, ABD waiver, and the In-Home Supports, IHS waiver. In this session, we will be discussing environmental and vehicle modifications, sometimes referred to as EMODs. We will describe the service, talk about a scenario, and then provide any additional information that may be important to know about the service. The information in this session is applicable to the Developmental Disability Waiver, the Acquired Brain Disorder Waiver, and the In-Home Supports Waiver. So how do the DD, ABD, and IHS waivers define environmental and vehicle modifications? These include modifications or adaptations and maintenance to the individual's home environment or vehicle, including installation of ramps, installation of grab bars, widening of doorways to accommodate the individual's wheelchair or other mobility access equipment, and supports that enable them to travel in greater safety, access the community, and carry out activities of daily living. So what does this mean and how does this help me achieve my goals? Environmental and vehicle modifications are changes made to a person's home or car to help them live more comfortably and safely. Now we will walk through a fictional scenario of an individual who is accessing environmental and vehicle modifications. Paul is a 35-year-old man with cerebral palsy. He lives in a single-story home with his wife and 2 children. While Paul navigates through life independently, he faces several challenges in his daily routine, such as navigating through narrow doorways, accessing different parts of his home, and traveling safely in his vehicle. So how does Paul access and use this service? Paul wanted assistance from a service provider specializing in accessible technology to improve his quality of life through home and vehicle modifications. After an assessment of Paul's needs and his living environment, the organization recommended installing ramps at the front and back entrances for easy wheelchair access, grab bars in the bathroom and near the bed for additional support and safety, widening doorways throughout the house to accommodate his wheelchair, and equipping his vehicle with a wheelchair lift and hand controls to enable independent driving and safe travel. So what is the outcome of this service for Paul? The home and vehicle modifications have improved Paul's mobility, safety, and independence, allowing him to move freely at home, perform daily activities with reduced risk of falls, and drive himself to work and community events, thereby enhancing his overall quality of life and providing peace of mind for his family. Lastly, we will discuss any potential service limits and requirements that must be included in the individual's service agreement. We will also discuss if this service may be provided remotely or while in acute care. When a service can be offered remotely, it means you don't have to be physically present at a specific location to use it. When services can be accessed in acute care, it means that individuals who are in a hospital or another urgent care type facility can still receive these important services. When waivered services have limits, it means there are specific restrictions or caps on the type, amount, or cost of services that can be provided under a waiver program. There is a service limit for environmental and vehicle modifications. For the DD, ABD, and IHS waivers, this service has a limit of $2,500 related to outdoor fencing. This is a soft limit though, and can be increased with prior approval from BDS. For in-home supports specifically, if this or any modification will cause the individual to exceed the overall in-home supports cap, this request must be approved by BDS and may not exceed an additional $15,000 over the course of a 5-year period. This service may not be provided remotely. However, this service may be provided in acute care. For requirements in the service agreement, the individual's service agreement should describe how the EMOD is necessary to ensure the health, welfare, and safety of the individual, or how it will enable the individual to function with greater independence in the home and community, and without which the individual would require institutionalization. Thank you. If you have any additional questions on environmental and vehicle modifications, please email bds@dhhs.nh.gov.